Okay.
The WHO study says death rates from cardiovascular disease, the leading cause of heart attacks and strokes, could double by the year 2020. And experts say the increase is caused by more than just preventable risk factors such as obesity, high blood pressure, and tobacco and alcohol use.
Tuberculosis, it turns out, is an important cause of heart disease.
Dr. Peter Hotes is president of Sabin Vaccine Institute and dean of the National School of Tropical Medicine at Baylor College of Medicine in Houston. He says many cardiovascular complications are directly linked to parasitic infections, such as snail fever or schistosomiasis, streptococcal infection, and syphilis.
The specific neglected tropical diseases that are responsible for heart disease are different in different developing countries. So, for example, in some of the poorest parts of Latin America, chagas disease is an important cause of heart disease. This is caused by a parasite that lives in the heart. We don't really have a lot of good medicines for many of these conditions.
There are drugs out there, but they're decades old. They've been repurposed from animal health indications and other areas. So they're old and they're toxic, and in many cases they're losing their efficacy because the organisms are becoming resistant to the drugs.
Eric Easom is leading the development of drugs for neglected diseases at Anacor Pharmaceuticals. He says there has not been enough financial incentive for the big pharmaceutical companies to work on new drugs for these chronic types of infections, even though studies have identified them as significant contributors to pulmonary hypertension and chronic heart failure. But controlling tropical infectious diseases could be crucial to reducing the global death toll from heart disease, especially in low-income countries. Don Joseph heads BioVentures for Global Health, a non-profit group that supports the development of new drugs, vaccines, and diagnostics for tropical diseases. Joseph says the drugs now available will not be able to reduce the growing global burden of these infections, and more research is essential.
We think that neglected diseases are crucial. They have a disproportionate impact on people who can afford it the least and who are affected the most.
Health experts say it is important to recognize the unique risk factors contributing to heart disease in developing countries so that effective treatment strategies can be designed. Vidushi Sinha, VOA News, Washington.